So we recommend doing digital x-rays in our practice once a year. The reason why we recommend that is because we can't see in between the teeth, and we also can't see how the bone is doing. So as a clinician, what I'd like to be able to see is compare what you look like today to last year. Because when I can see that there's osteopenia happening, meaning that the bone in the jaw is actually being diminished, I can start taking early interventions, and I can start helping you look at this earlier rather than waiting until you're 50. We can actually identify it by 40, 45. And especially when we see the change throughout time, it really helps us see what the problem is and how we can help you prevent more bigger problems down the road. And once you have osteopenia, it's absolutely challenging to like stop it, reverse it, or anything like that. Same thing with the beginning of a cavity, right? Or if we see a beginning of a cavity, we can give you tools and techniques to help prevent that. And then that way, instead of you needing a filling or needing 5 fillings, we're able to actually bring that down significantly for you. Or maybe even not need any fillings at all. So once a year is a good time for us to be able to see what's going on in between the teeth and in the bone level, the areas that we can't access with our naked eye, right? We can't see the bone level. We can't see in between the teeth. Like, what is that density? What does that calcium density look like? We can also not identify vitamin D deficiencies. Those are things that we identify over x-ray or digital x-rays to really be able to see what else is going on with the rest of your body.